should not statistically be here.
We are at war with a virus, and healthcare troops and first responders are on the front line fighting it every day.
This morning, deaths from coronavirus in the United States have surpassed 160,000. One of those victims, a 7-year-old boy from Georgia, the state's youngest person to die of the virus. Doctors say he had no underlying health conditions.
Sisters Kristen Campbell and Lauren Mays just lost their mom. Michelle Lee Carter, a healthy 53-year-old, lost her battle with COVID-19 Tuesday after 7 days in the ICU.
Early accounts said the mystery illness coming from central China could be transmitted far more easily than the flu, and that the death rate was remarkably high.
July was particularly deadly. More than 1,000 deaths on 11 out of the 31 days last month.
Researchers are now forecasting another 80,000 deaths in the U.S. by November.
From the information that we have so far, COVID-19 is more deadly than the flu. Somewhere between 10 and 20 times more likely for you to die if you get COVID-19 than if you get the flu. COVID-19 appears to be much more transmissible than influenza. It transmits more easily from person to person than what we see with the flu that we see every year. And because of that, we need to take some special precautions to make sure that people don't pass it easily from one person to the next.
Sort of restful, peaceful look.
I thought one of the nurses had taken a circular saw and just buzzed my arm off, and then just buzzed off both of my legs. Another circular saw came through the wall and just cut my head in half. I was positive they were trying to kill me.
When in fact, their brain is on fire.
Their brain, globally, what's happening, the cells aren't working right. They're not getting enough oxygen.
So you just wake up in a medication-induced haze. You've got a tube down your throat.
Under any other conditions, that would be considered torture. These two women pulled my arms down while they shoved a tube up my nose, and I was flailing.
Patients would have these vivid nightmare-like experiences of people torturing them and kidnapping them, blood dripping down the walls. People with animal heads walking around, or children who are floating by with no faces.
A young patient, and he thought the nurses were restraining his arms and attaching snakes to his arms, and that was then drawing blood from him.
We've had patients who are taken from the unit to get an MRI. They're convinced that they're being moved into an oven.
Emotionally, you're by yourself without my support system. You're in your head. You're almost dying.
Delirium seems to be one of the biggest risk factors. Half of the folks end up being unemployed if they were working previously, have the inability to run their finances, and that's pretty devastating.
You're having this tightness in the chest? Started on Monday, and you were just sitting down when it started?
If anyone is thinking of taking any chances, just take a look at me.
The symptom that I had in the hospital was my right hand primarily was shaking to the point where I said, I think I developed Parkinson's. I had a tremendous amount of muscle atrophy. I remember coming home from the hospital. My driveway to my front door was maybe, 25, 30 feet. I couldn't make it, I had to stop, get a seat, and continue. I'm here talking to you, so be careful, wear a mask, protect yourself, protect your kids, protect your family.
When she first went into the hospital, and we knew that we weren't going to be able to visit her, it just really gave everyone a sense of hopelessness and helplessness, that we wouldn't have anything that we could do, even if we wanted to hold her hand or to be with her.
We even kind of thought maybe she was going to come around, watching her there. But
and then we each were able to get on the house party app and spend time with her. They had a mask that just covered her face,
and oxygen was blowing through that mask. She said she's gone.
We need your help. Social distancing and mitigation, they're not to protect the 30-year-old or the 20-year-old from getting coronavirus. They're to protect your Nana. They're to protect your granddaddy. They're to protect the people who you love in your lives, and we need your help.
This is a war. We're in a war to contain this virus. The interesting thing is everybody has the same common enemy across the whole world.
It's a medical war. We have to win this war. It's very important.
During what is really a war. It is a different war than anybody has ever fought before, but it's a war that we're uniquely qualified to help.
We don't have treatment and we don't have a vaccine, so what do we have left? We have these community mitigation measures like social distancing, about staying away from people and staying home as much as you can.
If we can limit and stop the exposure, that can flatten the curve. That will allow the researchers to find the countermeasures and the vaccines. That's going to take time. We as soldiers and citizens must practice, again, the art and the science and the discipline of social distancing.